Hello, everyone, and welcome to today's webinar on COVID-19, Navigating the New Normal. Before we get started, I would like to go over a few items so you know how to participate in today's event. You have joined the presentation listening with your computer speaker system by default. If you would prefer to join over the telephone, select the arrow next to the unmute icon on the bottom of your screen in the Zoom toolbar. Select Switch to Phone Audio and then select Phone Call and follow the prompt to dial in. By default, all participants enter the webinar with audio muted. We are offering the webinar bilingually using simultaneous translation. During the presentation, some speakers will speak in English and others will speak in French. To hear the appropriate translation to the language of your choice, choose either English or French as your language preference in the interpretation icon in the Zoom toolbar.
Nous proposons ce webinaire dans les deux langues en utilisant la traduction simultanée. Pendant la présentation, certains conférenciers s'exprimeront en anglais et d'autres en français. Pour entendre la traduction appropriée dans la langue de votre choix, choisissez l'anglais ou le français comme langue de préférence dans l'icône d'interprétation de la barre d'outils Zoom. Merci.
Today's webinar is being recorded, and you will receive a follow-up email within 5 to 7 days with a link for an on-demand viewing. For those of you joining on your computer, you will have the opportunity to submit text questions to the presenters by typing them into the Q&A pane found in the Zoom toolbar at the bottom of the meeting window. Please avoid using the chat box to submit your questions. It helps us to monitor them more effectively when you all submit them in the Q&A pane. You may send in your questions in either language at any time during the presentation. We will collect these and address them during the Q&A session at the end of the presentation. In order to protect your privacy, when you ask a question, please do not use your name or provide any other personal identifying information. For those of you who have pre-submitted your questions, please note that due to high volume of questions submitted, your exact question may not be able to be answered directly. Now I introduce you to our moderator for this webinar, Lydia Lauder, National Director of Programs and Public Policy at the Kidney Foundation. Thank you.
Thank you so much, Sadia. May we advance the slides to slide 4, please? The Kidney Foundation of Canada would like to thank our sponsors of the 2022 webinar series: GSK Canada, Horizon, Otsuka, Paladin, and Takeda. As we all adjust to life with COVID-19, there are still many unanswered questions, especially for people with kidney disease or living with a kidney transplant. We are moving from a time when public health measures were in place to protect the masses and to keep our communities as safe as possible, to a time when individuals now need to make personal choices to assess their own risk and protect their personal health. For people living with kidney disease, there is still an increased risk for more severe consequences because of COVID-19. And as a result, the transition to a new normal may look very different to them. This webinar will bring together patients and healthcare professionals to talk about some of the following topics: why people with kidney disease may be struggling to define a new normal, personal stories of living in a new normal with kidney disease, new treatments for COVID-19, and travelling safely. Before we begin, we would like to recognise the Indigenous land that we are on. Inspired by the 94 recommended calls to action made by the Truth and Reconciliation Commission of Canada, land acknowledgements are a necessary first step towards honouring the original occupants of a place. They also help Canadians to recognise and respect Indigenous peoples' inherent kinship beliefs when it comes to the land, especially since those beliefs were restricted for so long. I encourage everyone to take a moment to reflect on that and acknowledge it. If you know the territory in which you're situated, I invite you to acknowledge it in the chat. I would like to acknowledge that I'm located in Toronto, which is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Wendat peoples. It is covered by Treaty 13, signed with the Mississaugas of the Credit, and is still home to many First Nations, Inuit, and Métis peoples. We respect the continued connections with the past, present and future in our ongoing relationships with Indigenous and other peoples across the country. The information shared in today's webinar is current as of today, June 14, 2022. The material shared in this presentation is not intended to be medical advice. We suggest people speak to their doctor about their own individual situation. This information is intended for a Canadian audience. We're so thrilled to introduce our speakers. Thank you all for making the time to share this important information today. We have a lot of content to cover today, so please visit our website to read their complete biographies. Dr. Upton Allen is a professor of paediatrics at the University of Toronto. He is Chief Division of Infectious Diseases, Hospital for Sick Children. Dr. Allen is a Senior Associate Scientist in the Research Institute, Hospital for Sick Children. He is the Interim Director of the Transplant and Regenerative Medicine at Sick Kids. In addition to being a general infectious disease specialist, he's actively involved in clinical and research activities related to immunocompromised patients, notably those who have undergone organ and stem transplantation as well as cancer therapies. He leads research studies addressing different aspects of COVID-19, including but not limited to the seroprevalence of SARS-CoV-2 amongst African Canadians. He is a recipient of the Order of Ontario. Corinne McNabb has been with the Regional Kidney Care Program at Simcoe Muskoka in Aurelia since 1999, working with patients in the multi-kidney care clinic and patients on hemodialysis, both in-centre and in satellite units. Corinne is passionate about palliative care, ethics and truth-telling. She is the Clinical Palliative Care Champion for the Ontario Renal Network and is currently the President of the Canadian Association of Nephrology Social Workers, or CANSWA. Dr. Veronica Silva graduated from medical school from Universidad Evangelica of El Salvador. She completed internal medicine training at Queen's University. She obtained her nephrology fellowship from the University of Western Ontario. She has been a staff nephrologist at Trillium Health Partners since 2012. She chairs the Peritoneal Dialysis Council at Trillium Health Partners. Dr. Silva is highly respected by both her colleagues as well as her patients. She always takes her time, shows empathy while listening, and acknowledges patients' concerns with having that human touch.
Louise Laviolette est atteinte de la maladie polykystique des reins, diagnostic que son père a reçu également. Après plus de 20 ans en prévention, les premiers signes évidents d'insuffisance rénale terminale se sont déclarés et Madame Laviolette a débuté la dialyse péritonéale nocturne à domicile. Ce mode de traitement lui a permis de conserver une vie active et professionnelle durant 3 ans et demi, malgré une grande fatigue. Puis, un jour, la nouvelle tant attendue est arrivée, un rein était enfin disponible pour elle et elle a pu être greffée avec succès. Madame Louise Laviolette est de plus une bénévole très impliquée à la Fondation du Rhin Division du Québec, entre autres dans le cadre du programme Entraide Jumelage et des groupes de soutien, mais aussi auprès des patients du centre hospitalier du CHUM, où elle est patiente partenaire. Elle participe également à plusieurs projets de recherche. Madame Laviolette va nous faire part aujourd'hui de son témoignage quant à ce qu'elle a vécu à travers la COVID-19.
Last but not least, it is my pleasure to introduce Richard Dubois. He was first diagnosed with Alport syndrome at a very young age and is currently 17 years into his second transplant. Also, at a young age, he discovered his passion for photography and creative projects and has worked as a commercial photographer ever since. Richard is delighted to volunteer for the Kidney Foundation from his home in Ottawa, where he lives with his wife and daughters. So now that we've got to know our speakers a little bit, I'm going to ask our speakers a few questions to get us started today. Richard, you're currently a patient, and can you share with us how you have felt traveling safely with large crowds, going back to work in person, and how that looks, along with the emotions, fears, anxieties of staying healthy and safe for those around you?
Thank you, Lydia. It's a pleasure to speak with everyone today. So on the very subject of navigating the new normal during kidney, I'm very happy to briefly share with you some of my experiences with going back to work over the past 2 years, really, specifically as it relates to working and traveling, and of course, balancing all of that with staying safe. I can recall way back in March of 2020, when the pandemic first began in earnest, and I was sharing with people on social media how I would basically continue to follow some very basic rules as a transplant patient. I would wash my hands frequently, use hand sanitizer when it was available. I would avoid touching my face. I would generally keep a safe distance from people in public. And in addition to that, I would be wearing a mask whenever I leave the house, which is in addition, because of the pandemic, of course, I'd be wearing a mask, and I wouldn't be visiting any malls or taking the bus or any kind of public transit anytime soon. But the biggest change with me was related to work. As Lydia mentioned, I'm a full-time commercial photographer. So my typical work week can involve meeting with a large number of people on set in a studio or another indoor location. And I also tend to travel a great deal for work, usually to Toronto and Montreal, but occasionally to other countries. Since the pandemic, of course, traveling, up until very recently, traveling has ended completely. And certainly I won't be traveling to any other countries for now. Naturally, for me, work came to a grinding halt at the start of the pandemic, in part because, well, for safety issues, but also because my clients were all postponing or canceling work. And I figured I would be taking a bit of a break for a while. For a few months last year, I did do remote work. I did a government contract working from home, and I did other remote work safely from my home. But for the most part, it's been professionally pretty quiet for me for quite a while. And as I said, travel has effectively ended. So fast forward to March of this year, roughly 2 years later, and I have now tentatively resumed some client work. Even though the pandemic is still going on, it does appear that most people are now, in Canada anyway, fully vaccinated, myself included, of course. And I was rather pleased to discover that some of these clients that I've reconnected with have also enacted safety protocols similar to the way I have. In fact, on a recent trip to Montreal with a brand new client, I arrived at the studio building and I was a bit surprised when I walked into the lobby and I saw there was a big lineup to get into the elevators. It turns out the building itself had a policy of only 2 people on the elevator at a time, and everyone had to show proof of vaccination and had to be wearing a mask. So obviously this was a great relief to me when I saw that. And given that there was a big lineup at the elevator, I was forgiven for being a little bit late on my first day at work there. So lately in Ottawa, and very recently when I visited Toronto, I've been working mainly outdoors, shooting architecture, working on some creative projects that are strictly outdoor. And for the time being, I'm avoiding indoor scenarios where it would be difficult to keep my distance from other people, and where the chances of being close to someone who may have COVID and not know it are a little bit greater. So what travel I am doing right now is strictly by car. I do like traveling by via rail, train, but that's out of the question now. When I do go to Toronto or Montreal, I drive. And I've also spent a lot more time recently reconnecting with clients and colleagues because this gradual return to work has been gradual for everybody, not just me. All of my clients and colleagues, they've all had to make a number of adjustments as well. But I do appreciate the sense that we're kind of all in this together, as it were, and I do feel I'm not alone in trying to assess all the risks of returning to work. So what does the new normal look like to me? Well, it's evolving, but I think the key word here for those of us who travel for work or work in groups or office environments is patience. Patience while colleagues and work clients deal with their own supply chain issues and staffing issues and safety issues. And patience while everyone basically regroups and figures out what the best way is to do things safely as they return to work. For my part, I've been rather happy that most of the people I know are still very mindful of the pandemic, and that has alleviated many of my concerns recently. So I'm very curious to see how things are going to look, say, about 2 years from now. However, in the meantime, I'm quite content to take things very slowly. So thank you very much for your time and letting me share a little bit of my work experiences with you.
Thank you so much, Richard. Really pleased that you could share those experiences with us today. I'm sure there'll be some questions. What I would like to do is, if Louise is ready, I would like Louise to invite her to come and speak. You have the interpreters, so please do feel free to speak in French if you feel more comfortable.
Yes, it will be easier for me. Okay, thank you. So, okay. Well, je m'appelle Louise Laviolette, je suis une patiente, je suis greffée depuis 9 ans maintenant. Et je vais vous parler un petit peu parce que moi, j'ai attrapé la COVID, j'ai eu la COVID, alors j'ai vécu cette expérience-là. Donc, en partant d'abord, la pandémie était comme une surprise pour tout le monde. On a vécu beaucoup de stress, beaucoup d'anxiété. On avait tout à négocier avec un nouveau mode de vie, donc on a été bien isolés. Et au cours, ça a duré longtemps, puis petit peu par petit peu, il y a eu des petits relâchements, des petits resserrements, mais il est arrivé aussi les vaccins avec beaucoup d'espoir pour nous, en tout cas, pour nous, les greffés, les immunosupprimés, ça a été beaucoup d'espoir quand les vaccins ont commencé à surgir. À un moment donné, évidemment, toutes les mesures ont été relâchées. Et là, ça a été compliqué à gérer aussi parce que je ne dirais pas que c'était de la paranoïa, mais comme les gens suivaient moins les mesures, comme il y avait moins besoin, nous, on avait encore un peu plus peur. Mais le principal dont je vais vous parler, c'est la COVID. Un matin, je vais vous raconter mon histoire, ça va tout vous expliquer. Un matin, je me suis levée, je faisais une forte fièvre et j'avais mal au côté gauche dans la région où est mon greffon. Donc, évidemment, ça m'a beaucoup inquiétée. J'ai tout de suite téléphoné à la clinique de greffe et à la clinique de greffe, on m'a demandé de me présenter à l'urgence. Donc, je me suis emmenée à l'urgence en me disant, ah ben là, je sais que je fais une pyélonéphrite parce que moi, j'ai une historique très grande d'infection urinaire. Asymptomatique, et quand il y a un symptôme qui se pointe, ben, c'est rendu une pyélonéphrite. Alors, moi, je m'en vais à l'hôpital en me disant, je fais une pyélonéphrite. J'arrive à l'hôpital, au triage, je dis, je suis greffée rénale, immunosupprimée, je fais 39,8 de fièvre et j'ai mal à mon côté, où il y a mon greffon, et ça a été instantané. J'étais, dans le temps de le dire, installée sur une civière avec tout le protocole, et le protocole inclut un test COVID. Donc, au bout de quelques minutes, je vois quelqu'un arriver avec une pancarte qui me dit chaud plus. Donc, madame, vous êtes positive à la COVID. Je tombe en bas de ma chaise. Je ne m'attendais pas, mais pas du tout à ça. C'était pas du tout dans les possibilités. Ça ne ressemblait pas à mes symptômes. J'avais que de la fièvre et mal au côté. Je n'avais pas de toux, de maux de gorge, de difficulté à respirer. De perte d'odorat, de perte de goût. Il n'y avait rien de ce que je connaissais des symptômes de la COVID. Alors, évidemment, on m'a tout de suite isolée et rapidement, mais extrêmement rapidement, j'ai été prise en charge autant par l'équipe de l'urgence que par l'équipe de transplant. Donc, ce qui est arrivé, c'est qu'on m'a tout de suite, on m'a expliqué que comme j'étais immunosupprimée, j'avais la possibilité de recevoir des antiviraux. Alors, très rapidement, on a commencé d'un côté avec des antibiotiques pour la pyélo et d'un autre côté, des antiviraux pour la COVID. On m'a expliqué que les antiviraux, en fait, leur principal rôle, c'était, il y avait beaucoup de rôles, là, mais pour les néophytes, là, pour nous, les patients, le rôle, c'était que ça faisait diminuer en temps et en force les symptômes de la COVID. Donc, moi, je demandais pas mieux. Et d'un autre côté, on soignait aussi ma pyélonéphrite. Alors, évidemment, j'ai eu une discussion avec mon médecin, mon néphrologue, et je me sentais très, très, très coupable. Je vivais beaucoup de culpabilité. Je me disais, qu'est-ce que j'ai fait? Comment ça se fait que je l'ai attrapé? Où est-ce que j'ai pris ça? Quand? Comment? C'est qui? Je me posais des tonnes de questions et ça me troublait beaucoup. Et mon médecin m'a quand même bien rassurée là-dessus en me disant, écoutez, là, on est dans c'était quand même au mois d'avril, on est donc dans les variants de Micron et ils sont extrêmement contagieux. Donc, vous en faites pas avec ça. Perdez pas d'énergie avec ça. Allez plutôt à prendre votre énergie pour récupérer. Donc, ça a bien soigné ma culpabilité, mais quand même. Je trouvais que c'était quand même pas facile. J'ai été hospitalisée pendant 6 jours parce qu'il fallait prendre le temps des antiviraux. Il y avait 2 sortes d'antiviraux. Il fallait prendre le temps aussi de soigner la pyélonéphrite, de faire des examens. Mais pendant ces 6 jours d'hospitalisation, je dirais qu'après mon entrée à l'urgence, après même pas 1 heure, la fièvre était tombée. Je n'avais pas de symptômes. Pour moi, c'était, je comprenais pourquoi j'étais à l'hôpital, mais je n'avais pas de symptômes. Donc, je passais mes journées avec beaucoup de mobilité dans ma chambre et isolée, évidemment, mais quand même, je n'ai pas souffert de symptômes. Quand je suis arrivée à l'étage COVID, j'ai demandé au médecin, ça fait 2 ans passés qu'on parle de COVID, puis c'est comme si j'y connaissais rien. Donc, c'est quoi? Je dois m'attendre à quoi? Demain matin, je vais me lever avec des problèmes respiratoires, des problèmes. Et le médecin a souri en me disant, non, non, parce que là, tous vos symptômes, vous les avez déjà tous eus. Il n'y aura rien de plus fort que ça et on continue de les soigner. Donc, ça a été assez important. Suite à ça, je vous dirais qu'il n'y a rien resté. Bon, pour faire la petite histoire courte, je n'ai pas eu de rien qui s'est passé dans mon greffon. C'est-à-dire que oui, mon greffon a eu des petites zones d'infection qui se sont résorbées et il n'y a pas de dommages sur mon greffon. Après avoir passé une scintigraphie puis un Doppler, on a vu qu'il n'y avait aucun dommage sur mon greffon, ce qui m'a beaucoup soulagée. Ce qui reste, en fait, de ma COVID, je vous dirais, c'est de la fatigue. Pas mal de fatigue au début. Maintenant, ça s'est stabilisé, mais le soir, je suis plus fatiguée. On dirait que j'ai moins d'énergie et ça perdure un peu. Moi, ce que ma COVID m'a appris, en tout cas, c'est vraiment à gérer ma culpabilité, je dirais. Donc, j'arrête de me sentir coupable de tout. À comprendre ce qu'on dit quand on dit que les vaccins sont efficaces pour nous protéger des symptômes, pas nécessairement de l'attraper, mais que si on l'attrape, ça va vraiment gérer nos symptômes de façon plus simple. Alors ça, c'était abstrait un peu pour moi, mais là, maintenant, c'est vraiment concret. Et toute l'efficacité des antiviraux auxquels on a droit, et ça, j'avoue que c'est d'une très grande importance. Ce que j'ai appris aussi, ce qu'on m'a appris, c'est que je vais faire ça très imagé, là. Les scientifiques vont trouver que je tourne les coins ronds, mais comme au moment où le virus est entré dans mon corps, il a pris 3 secondes d'écart pour scanner mon corps puis dire, est-ce qu'il y a une petite faiblesse dans ce corps-là où je pourrais m'installer? Et bang, il a vu mon greffon et c'est là qu'il est allé s'installer. C'est comme ça que ça fait plus que 2 ans que je dis toujours aux gens, ben nous, les immunosupprimés, les greffés, il ne faut pas qu'on attrape la COVID parce qu'on pourrait avoir des effets plus importants. Ben là, j'ai vu c'était quoi les effets plus importants. Je disais ça, comme je répétais cette phrase-là comme si je l'avais apprise, mais là, j'ai compris c'était quoi. Maintenant, ce que j'ai appris aussi, c'est l'importance d'être attentif à soi, d'être attentif à son corps et d'être réactif. Quand il y a quelque chose qui ne fonctionne pas, on se connaît. Quand il y a quelque chose qui ne fonctionne pas, on va à notre clinique de greffe, on appelle quelqu'un, on réfère à quelqu'un parce que plus vite on s'en occupe, mieux c'est. Maintenant, pour moi, ça a été rapide quand même après mon isolement, après ma sortie d'hôpital. Je suis retournée au travail. Évidemment, j'ai toujours, et je vais continuer, je ne sais pas pendant combien de temps, mais je vais continuer quand même à porter mon masque quand je suis dans des endroits publics. J'ai constaté, j'ai fait un test et j'ai constaté qu'il n'y a absolument personne qui nous regarde de façon bizarre en disant « Bon Dieu, pourquoi tu portes un masque encore? On n'est plus obligé. » Alors, ça, non. Puis les mesures qu'on a toujours appris, forcément, quand on est en insuffisance rénale ou quand on est greffé, on a déjà pratiqué. Et on le pratique normalement. Moi, en tout cas, ça fait au moins 9 ans que je le pratique, le lavage des mains en profondeur est très régulier. Et le masque aussi. Et on a tout réappris, en fait, les câlins, comment on fait des câlins, on n'en fait plus, comment les gens comprennent ça très bien. Alors, on se donne nos réserves, on se connaît, on est capable de savoir, de prendre soin de soi. Puis, quand on est bien là-dedans, je pense que les gens comprennent qu'on prend soin de nous. C'était une expérience que je n'aimerais pas revivre. Je n'irai pas jusqu'à dire que je suis contente de l'avoir vécu, mais ça m'a appris beaucoup de choses. Et ça a surtout confirmé que ce qu'on m'a dit depuis le début de la COVID, qu'en étant vacciné, en faisant attention et tout ça, bien qu'on s'en sort, puis on s'en sort de belle façon. Et je me considère très chanceuse d'avoir le seul effet secondaire, le seul effet qui perdure, c'est un peu de fatigue. J'aurai 70 ans bientôt. Je pense que la fatigue, ça va faire partie maintenant de ma vie. Alors, bon, quelle est la part de COVID et quelle est la part de l'âge, je ne sais pas, mais voilà. Je ne sais pas si ça répond à toutes vos questions. Lydia, tu peux peut-être, s'il y a des trucs que je n'ai pas touchés qui seraient importants.
Merci beaucoup, Louise. Thank you very much for sharing your story. And I think you've covered quite a lot of ground there with your experiences, and we really value you sharing your story today. I note that there's already been quite a number of really great questions in the question and answer panel, which we are going to circulate back to.
Okay.
So please do keep those questions coming, put them in the question and answer panel. But I'm going to ask Dr. Allen a few questions. As we've all been living with COVID for a couple of years now, and you have a better understanding of COVID and what that means for immunocompromised patients. Are you able to speak to that today, and what immunocompromised people need to know to stay healthy, stable and safe while living their lives? And also, are there any preventative measures or treatments available to people who are immunocompromised?
Thank you so much, and it's a pleasure to be here. It's a really important question. I thought it might help if I put on this slide, as you can see, 4 bullets that will capture the essence of what I'll say over the next 3 to 5 minutes. First is what really is the immunocompromised state or state of weakened immune systems. And essentially, in summary, some individuals have an immunocompromised or a weakened immune system because of a medical treatment that they have received for an underlying medical condition. And this includes, for example, individuals who have had cancer, who are being treated with chemotherapy, who have had solid organ transplant or bone marrow transplant. In the case of a solid organ transplant, for example, it might be a kidney transplant or heart transplant. And these individuals are taking medications to ensure that they keep their transplant. Now, there are other folks who have had certain types of medicines for their underlying conditions for a very long time. For example, their immune systems might be weakened because of a long-standing use of medications such as corticosteroids. And these situations where the immune system gets weakened because of the use of medications is referred to as secondary or acquired deficiencies. There are others who are born with immune deficits, and that is typically referred to as primary immune deficiency. Now, we do know that individuals who have weakened immune systems have certain consequences in terms of the impact of infections such as COVID. In the case of COVID, for example, they are at greater risk of having COVID with symptoms as opposed to asymptomatic COVID, where an individual who has an immune system that is not weakened, they get infected with the COVID virus. It's often a mild infection, though it can be severe, and it might be totally asymptomatic. The person with weakened immune system is more likely to have symptomatic illness, and they are more likely to have illness that is more severe. So they can end up in hospitals, end up in intensive care units, and can have pretty bad outcomes. Now, we also know that individuals with weakened immune systems might not respond adequately to vaccines. And this is a particular concern because we want to ensure that these individuals are protected at all times from various illnesses using vaccines. Now, in the case of COVID-19, the response to vaccines is particularly problematic. There are some individuals, for example, some transplant patients who have very, very poor responses to vaccines. And there are others who might have better responses to vaccines, but those responses don't last. And so the challenge then is to ensure that we protect these individuals in different ways. So one way that we do this relates to the concept of creating protective cocoons. And what do we mean by this? So in an ideal world, when you try to prevent an illness in someone, you give them a vaccine and you hope the vaccine works well. But sometimes vaccines do not work very well, as alluded to, because of the strength of their immune systems. But the second way you can protect those individuals is by creating a protective barrier around them by vaccinating those around them. And so in the case of a transplant patient, for example, a kidney transplant patient at home, we want to ensure that other family members do not bring infections into the home, so be it chicken pox or measles or the COVID virus or influenza, that they are protected. The patients with weakened immune systems are protected by ensuring that those around them are also protected. But the protective cocoon might not necessarily end with vaccination. There are the public health measures that one should undertake when dealing with individuals who have weakened immune systems. So where appropriate, the hand hygiene measures that Richard so eloquently summarized, the use of masks, as these summarize as well, where appropriate. Key concept then is the creation of this protective cocoon around the individual with weakened immune systems. And then finally, I thought, as we think of the new norm, Lydia, we need to think of what are the treatments that are available for individuals with weakened immune systems and who have COVID-19, risk of COVID-19. And I would say that we can think of this in two categories. First are the strategies that could potentially be used even before individuals get COVID. And there's a medication called Evusheld, which is an antibody preparation that has been approved for use in individuals who have had or deemed to be at high risk of getting COVID and having bad outcomes. And these are injections that have been approved for use in individuals with weakened immune systems. So you would need to connect with your physicians to determine if you're eligible for Evusheld and how it ought to be administered. This is what's referred to as pre-exposure prophylaxis. So this happens before you get exposed. The second approach is if you get COVID, then at an early stage, before you get significantly ill, within a matter of a few days, there's a medication called Paxlovid, which might be of value to you. It is important, though, to note that this Paxlovid medication interacts with several other medications, including immunosuppressants. So it's going to be really important to connect with your doctor to determine if you're eligible for Paxlovid, and if you were to use it, what adjustments might need to be made to the various medications that you're taking. And then the third category of medications, hopefully it doesn't get this far, Lydia, would be if individuals are ill enough to be admitted to hospitals, then there are treatments that one would use based on the severity of their illness, the use of corticosteroids, a medication called remdesivir, and other medications depending on the severity of illness that help to dampen down the immune system. But sometimes what happens when one gets COVID is that the immune system overreacts. And so some of the medications that are given help to calm down the immune system so that the body, person's body, so to speak, does not become damaged by their own immune system trying to react to the COVID virus. So we've covered a lot, but I thought that I would, Lydia, focus on these 4 areas. What do we mean by the immunocompromised state? What are the consequences of having a weakened immune system? The concept of the protective cocoon, this is really crucial. And then, of course, a summary of the available approach to COVID management before the exposure occurs and then after the exposure has happened. Thank you.
Thank you so much, Dr. Allen. Really thought-provoking, lots of great answers there, and I see there's even more questions coming through. So I look forward to sharing those questions with you and the other panelists at the end. So thank you very much. I'd also like to invite Dr. Silva to answer some questions for us today. We know that people on dialysis were really impacted by COVID, particularly during the earlier waves. Can you please provide some insight into what dialysis patients need to know with COVID, how they are coping, and how renal staff can support them within the hospital environment? Also, are there any preventative measures or treatments that are available to people specifically on dialysis?
Thank you very much for asking me to participate in this very important webinar. I think the questions are quite important, and I'm not sure entirely if I will be able to answer all of them as well as I should. But the landscape in the dialysis population of patients has changed since the beginning of this pandemic, and for the good, I think. It was very sad to see our dialysis unit in the first wave have a huge negative impact on the number of COVID-19 positivity and positive infections, and how most of our dialysis patients were affected very seriously, and the severity of the infections that they manifested. And it was quite sad to see the reaction amongst the dialysis patients who did not get affected, because as you may all know who are on the call or on the webinar, dialysis patients become family to each other. They know each other very, very well. They sit next to each other 3 times a week. They talk to each other. They become sisters, brothers, parents, cousins. And when a loved one is sick, it's very hard on them, not just because they see the other person ill or they know they're ill, but sometimes because that person is lost. And unfortunately, during the first and second wave, our dialysis units in the country were very much impacted. And unfortunately, our unit here in Mississauga had one of the highest rates of COVID-19 infection. And at the time, we had no means of treating anybody. We had no vaccine. We had no medications to preemptively prepare these patients in their immune system. And we had no treatments for those that contracted the virus. Nowadays, as Dr. Allen mentioned, we do have options. And our unit has come a long way in terms of surviving COVID. And our patients are, I would say, in a better place to be prepared to handle the infection if they were to contract it. And recently, as I looked around the unit prior to do this webinar, I saw a few patients that had become positive, but it was so reassuring to see that they had no symptoms, if any, or very, very minimal symptoms. And the reason for that has been all the measures that have been put into place until now with respects to vaccination, with respects to masking, with respects to hand hygiene, that I think has put them in a better place to be more prepared to fight this virus if they had to be faced with the infection. So I think from the early days till now, our dialysis units have grown a robust means of armamentum to be able to be in a better position. But it is very important to really follow the public health measures that our ministry puts into place. And this virus is new. It's only 2.5 years old for us. We're still learning. There's still lots that we don't know about this virus. And I think that the more knowledge we gain as time goes on, that knowledge is best interpreted by our leaders in healthcare, and recommendations are put forth as a result to try to protect our patients. And I think it's important to follow those health guidelines for everyone involved. And 5 years from now, we may find out that some of these measures may not have been as important as others, but this is the best information we have available because we're all new to this. Everyone has no previous experience with COVID-19. So it's important to keep that in mind. In terms of the dialysis unit, staff will continue to wear their masks in an effort to protect everyone, those they care for, and be adherent to, knowing what their bodies are telling them. If they're symptomatic, taking measures, maybe not to come into work, getting tested right away, getting our own vaccines, because we are mandated to be vaccinated in order to care for patients. And you can continue to expect that from the dialysis team whenever you come in. You can also expect that this probably isn't going to change in the near future. I think the masking is probably going to stay for a long time. And it's actually a good thing to have, especially in the fall and in the winter, because that's when our influenza rates are also higher. So that's what you can expect. You can also expect from time to time to have surveillance swabs done by our staff to look at any patients who may have maybe carrying the virus, but maybe asymptomatic in an effort to protect the others in the unit. So you may be asked to do a swab periodically. That will come from, the renal staff as well. And then in terms of patients, what you can do for your other patients and the unit itself is to adhere to the recommendations set by the unit. Like I said, I don't believe masking will be discontinued anytime soon. Hand hygiene will always continue to be in place. And it's important to report any symptom that you may have that you may not think is important or severe, or it could be very mild, but it is very important to report those symptoms when you come into the unit and the nurses are asking the screening questions. Even if those symptoms are not part of the screening questions, it's very important to come forth with any other symptom you may have. And in terms of what you can expect from your nephrologists, I think Dr. Allen brought up a lot of information about therapies that are available. And we will be discussing these therapies with individual patients that it's applicable to. But with respects to the dialysis unit, there are means by which we can get medications for our dialysis patients as well in a prompt manner to try to prevent hospitalizations. But I do have to say that the environment in which we are living now compared to 2 years ago is much more hopeful. It's looking very, very promising. Like I said, when we are being notified about positive rates in our dialysis patients, they usually are asymptomatic, and that's largely due to all the measures put in place, including the vaccination. So I'm very hopeful that it will continue like this from this point forward.
Thank you very much, Dr. Silva. Really do appreciate that. And lastly but not least, I'm going to invite Corinne McNabb to speak in her role as a renal social worker. Corinne, can you share your perspectives of how patients are managing COVID, especially going back to work, traveling, grocery shopping, and all the activities that we do day to day? Can you suggest some effective coping mechanisms to make it easier for patients to navigate this new normal that we're experiencing? And also, just a few questions for you. Have you come across some measures that people are using to stay healthy and have a positive state of well-being?
Thanks, Lydia. I'll try my best. Yeah, I think we're all kind of trying to integrate back into life. And I would say our patients are sort of representative of the general population. Some are fearful and some are hopeful, and there's some relief. I would say that we all want to sort of get back to some kind of normal. People miss their families, and isolation has been very difficult for people, especially those with mental health illness. So I think people are starting to socialize with family again, seeing the numbers come down. They're getting out of their house and traveling a little bit. But there are other patients who are not comfortable with doing any of those things. So some are still isolating themselves. They're being very careful, especially the transplant or failed transplant patients that we see. They're even hesitant to come to the hospital now that we're starting to have people come back to clinics and telling us they only want sort of telephone appointments. And the reality in the hospital, even though the general population, I think, thinks COVID is over and is kind of going back to life, the reality in the hospitals are very different. As Dr. Silva said, like mask policies are still in place. There are still very strict rules about who can visit at the hospital if you're admitted. Families are not allowed in the dialysis units yet, at least not that I know of, which creates all sorts of other problems. Patients are starting dialysis alone. And we have patients who we would normally ask family to come and sit with, whether there's behavior issues or cognitive impairments, who are having to be on dialysis alone. And so I think we're still dealing with all of that. It's still very much a reality for us. And then there's also all the social things that are happening, and transportation providers are still have strict rules as well, so they're not able to cohort patients. And I just spoke with a family member today that the transportation providers are burning out as well. They need some holidays, and so we have people right now who aren't able to get to dialysis. And so I think out in the community, the reality is one thing, but we're still dealing with all of that. And then, of course, increased costs of groceries and gas. And, when we talk about our patients coming 2 or 3 times a week to the hospital, and they may be traveling to get to their treatment over an hour, it does mean, like, some of them are really, we're reaching out to the Kidney Foundation for more assistance for all of those things. So we're definitely not through the crisis yet, I think, with a lot of the aftermath. And so it's kind of, even talking to colleagues, we're tired, and so the patients are tired. And I think it's really being vigilant with all the public health measures, but then also just trying to keep up with all of these things that are now we didn't realize were going to be the effects. I mean, I think we knew that there were going to be effects on mental health, but we didn't realize all of the other things that are going on as well. So suggestions are just, as we've been saying all along, you really need to take care of your body, and whether that's, getting all of your vaccines and boosters, and following your diet, taking your medications. What we've been suggesting, as we've done other webinars as well, is really taking a break sometime from the news stories. I think we're not as bombarded as we were in the beginning with all the numbers and how many COVID cases there are around the world. But I know there are still some people who are very plugged in to social media and news, and it just gets overwhelming. Now that we're able to connect again with family, that's really important. Connecting with family and friends, however you feel comfortable and safe doing that. With your faith groups, I know some churches have started having services again. I know they were doing a lot of virtual things during COVID. Connecting with your community, and that includes the Kidney Foundation and all the support groups, and watching the webinars and learning how to keep yourself safe, some things like this. And then really making time to unwind and de-stress, to do some activities you enjoy. And that is something that, as health professionals, we've really had to focus on as well, because there's really a lot of burnout and a lot of shortages, and nobody really wants to work in the hospitals anymore, which is also affecting the patients because we're short-staffed. And so I think I was thinking when I was writing this, it sounded like very Debbie Downer, but I think we're really living a different reality in the dialysis world and kidney world than otherwise. And so I think we just need to be mindful of that, and all just take care of each other and ourselves.
Thank you so much, Corinne. I think some really wise words to end your session there, and something that we could all value a lot. And we've had quite a few questions come through. I'm going to do my very best to get through most of them if I can today, but in the interest of time, we may not be able to. What we will offer, however, at the end, we'll be sharing our email address. So if you do have further questions that we aren't able to address today, we'll be more than pleased to address them with you offline as well. So I'm going to start with some questions for our 2 patient speakers, Louise and Richard. There's been a few comments and questions about traveling, and also whether you have a significant other or family members that work outside of the house, and how have you managed that from a day-to-day perspective. So Louise, may I ask you to start with that question?
Excusez-moi. Dans mon cas, pendant toute la pandémie, j'ai continué à travailler, mais j'avais la possibilité de faire du télétravail ou de faire du travail au bureau, mais quand il n'y avait absolument personne, parce que je m'occupe des ressources humaines, et en tout début de pandémie, j'ai dû mettre à pied 90% des employés là, pour une période qu'on souhaitait courte, mais bon, en tout cas, qui est arrivée, c'est une situation qui s'est produite plusieurs fois. Donc, j'ai continué, moi, à travailler. Et oui, mon conjoint aussi travaille à l'extérieur, mais on travaille ensemble. Mais oui, c'est une gestion, je pense, qu'il faut prendre au sérieux. C'est une gestion de quand même faire attention. Et je reviens à ce que je disais tout à l'heure, de toujours bien se laver les mains, toujours porter les masques, pas se trouver, en tout cas, éviter les endroits où il y a beaucoup de gens. Et essayer de prendre toutes les précautions qu'on connaît, parce qu'on est en insuffisance rénale, on apprend beaucoup de choses, donc on les connaît, ces précautions-là. Je m'apprête à faire mon premier voyage la semaine prochaine, quelques jours à New York avec mon petit-fils de 5 ans. Et oui, ça me rend un peu anxieuse, mais en même temps, je pense que je vais quand même faire confiance à ce que je suis capable d'évaluer comme mesure à réaliser. Et moi, je n'ai pas du tout de gêne à porter mon masque en tout temps, puis ça ne me pose aucun problème. Donc, ce sera ma première expérience de voyage depuis longtemps, moi qui avait l'habitude de voyager beaucoup. Mais en fait, je me dis, l'essentiel, c'est que je me dis, il faut qu'on reprenne une vie un peu normale. Et l'important, c'est de mettre ses limites. Je ne veux plus, je travaille dans un milieu où les gens sont très chaleureux, ça s'embrasse beaucoup, ça se fait beaucoup d'accolades et tout ça, mais moi, j'en fais plus. Et les gens respectent ça beaucoup aussi. Donc, je me sens quand même rassurée là-dedans. Je m'écoute beaucoup. Je tiens à mes mesures que je me suis fixées, moi, et qui sont très prudentes, parce que je n'ai pas envie de revivre ça, même si ça s'est bien vécu. C'est à peu près ce que je peux vous dire pour le moment.
I think it's really important that you set those boundaries for yourself and you living within those, and the people around you are respecting them as well. Thank you. Richard, would you like to speak to whether you also have a significant other that is going to work outside the house, and how you've coped with that as well?
Yeah, well, it so happens that my wife works from home currently, and she's been doing so for the past 2 years. Previously, before the pandemic, she did leave the house to go to work, but because she's able to work from home, she's been doing so ever since. So it's really me who is in danger of bringing COVID home at this stage, because I'm the one who's venturing out into the world. We both have a home office, and she will regularly put up a little sign that says webinar or training session. She's a wellness coach, and she conducts exercises and things like that online. And she's able to do all of these things online as it is. So she just continued to do that just because. But if she were to return to work outside of the home, and no doubt she will at some point, I'm fairly sure that she and I are on the same page in that we would follow the same guidelines, the same safety precautions as I mentioned earlier, keeping distance, wearing a mask, using hand sanitizer, etc. And more importantly, when it comes to client work, in my case, if I feel a work situation is unsafe, I will simply not do it. I'd rather not. I'm happy. I enjoy work. I enjoy the work I do. But if I'm ever placed in a situation where I think that I'm going to be at risk of contracting COVID, I simply won't do it. And I'm very certain that my wife feels that way as well. So really, when in doubt, stay away. That's our work ethic right now.
Thank you so much for sharing that. Really do appreciate it. And I think I might borrow your wife's idea about the webinar sign. I have school-age kids who don't follow that boundary, so that might be something that will help. Thank you. Now, we have a number of questions about the vaccines and transplant recipients. So we might start with Dr. Allen. There's been a couple of questions about people not responding to the vaccines, wanting to know whether that is still correct, and they're feeling very vulnerable because they can't. I was wondering if you could just speak to the vaccines and the transplant community a little bit more, and what people could do just on a day-to-day basis if they really, if the vaccines aren't working effectively for them.
Yeah, thank you very much. I think it's a really important question. For transplant patients, we know that there is a spectrum in terms of how people respond to the vaccines. There's some people who, when they get vaccinated, it's almost like your gas gauge dial, it barely moves, if you're empty. Whereas there are others who get vaccinated and the dial moves up to 40% or 50%, but very rarely much greater than that in terms of overall response. That said, being vaccinated as a transplant patient is better than not being vaccinated. And the number of doses that the transplant patient requires is still being looked at. But it's not unusual now to find some people are getting their 4th or 5th doses. And so the nature of the vaccination program for those individuals in the years to come is still somewhat unclear. The other point to remember is that even if someone doesn't have adequate antibody responses, it's possible that they have other parts of their immune systems that are working. So for example, another part of the immune system that's called cell-mediated immunity, that part might be working. So their cellular component of the immune systems might be working, though again, not to the extent where one would see the same level of protection as one would see in somebody whose immune system is not weakened. But it speaks to the importance of ensuring the protective cocoon is still maintained for individuals who are transplant patients who have been vaccinated, and not just the protective cocoon, but also the public health measures that Richard alluded to, the sort of common sense strategies that Richard also eloquently outlined. I think those are really important to protect the transplant patient who unfortunately is not able to get the benefit from vaccines as we would like them to get, but they do get some benefit. And it's important to bring out one other point in relation to vaccines among people with weakened immune systems, or vaccines more generally in a COVID situation. When we think of vaccines and what vaccines are doing, Lydia, we often think that we're trying to prevent infection. And maybe as a medical community, we should have done a better job in articulating what we're really trying to do. We're really trying to prevent 3 or 4 outcomes. Number one is that if you get vaccinated, you don't want to get an illness that causes you to die. Number two, you don't want to get an illness that puts you in the intensive care unit or in hospital for that matter. And number three is that you don't want to get an illness that is so severe that you're bedridden for days and days, even if you're not admitted to hospital. And then number four, if you did get an illness, that it is mild. And so even though the vaccines might not be 100% in protecting you against all of those, if it covers the first 3, mortality, severe disease, being moderately ill, and all you get is mild illness, then it's not so bad after all. So we just need to think about the effect of vaccines and what they're doing, targeting different types of COVID-related outcomes.
Alan, really appreciate that that thorough response. And Dr. Silva, we've had some questions come through about people with CKD, people who are close to dialysis. Would you be able to comment on some of the risks of COVID and also the new normal that we're experiencing for people with either later stages of CKD or people about to start dialysis?
Those are very good questions. We know that patients who have kidney disease due to an underlying inflammatory condition for which medications have been given to them to suppress their immune system are at risk because they have acquired immunodeficiency, like Dr. Allen explained. It will depend a lot on that individual. Not all CKD patients are alike. Some more advanced patients also have comorbidities or other chronic medical illnesses that places them at higher risk for severe infection from COVID-19 that may not be related to their CKD, but their other comorbidities as well, like diabetes or lung disease, cardiac disease. A lot of our patients with kidney disease have these other medical illnesses that also are very prevalent or very commonly seen in association. So that would definitely put a patient with kidney disease at higher risk. We also know that patients who get vaccinated in the earlier stages of their kidney disease, so when their kidney disease is milder as opposed to more severe, or once they're on dialysis, their immune response is better the earlier in their stage of CKD or chronic kidney disease than in the later stages. So the sooner you get vaccinated with any of the other vaccines available to the general population, the better it is, the more of an immune response you will mount. So I think patients with advanced renal failure are at risk, but their risk is also determined by their other medical conditions. That
I think that's a really great answer to that. And now this question I'm going to ask Corinne, but I will also open it up to the other panelists who may have something to say as well. We've heard concerns now that a number of provinces have lifted all their guidelines. A number of provinces have no health guidelines or very minimal health guidelines at the moment. What can people who have chronic kidney disease or a transplant do to help cope with this situation now that they are facing this new normal?
Well, I think just like other people have said, like the Richard and Louise particularly, you have to take care of yourself. You have to recognize that there are not going to be necessarily public health guidelines, but you have to know what makes sense for you as a patient. And if you're going to wear a mask, then you have to be okay with that. If you're going to go places, you have to find out what the regulations are, if there are any, and then you have to make a decision about whether you're okay with that or not, whether that's work or a social situation. And I guess you're going to have to, just like when you have to travel as a dialysis patient, you're going to have to do some of this legwork ahead of time, right? You're going to, even if you're going for dinner at someone's house, you're going to have to find out, are people there vaccinated and what your comfort level is with these things. And the same with work. You might have to have a conversation with your employer to find out whether you can work a little bit differently, whether that's from home or whether you can protect yourself in your work environment, whether your desk is far enough away from people or whether you still want to wear a mask and you're going to let them know, those kinds of things. And so I think it's going to be very individual, but I think this is the time to really make sure you're standing up for yourself and taking care of yourself.
Thank you very much. And Dr. Allen, I have a couple of questions here about people with young children, and I'm going to get your opinion as a pediatrician, that some families are having a really hard time, some with young children, some with older children who are socializing and teenagers who are socializing, where a family member may either be on dialysis or have a transplant. Especially little kids who are touching their faces a lot, who can't wear masks, who can't, really be expected to stay away because they are toddlers or they are socializing as teenagers as well. What tips or hints do you have them so that those families can stay safe in these circumstances?
Thank you so much. It's a really great question. It's a very, very common question that we get. And I must say that there isn't a one size fit all approach. What I would say though is that it's important to have planned interaction. In that regard, the sort of last minute spontaneous pop-over visits and so forth can be a little bit more challenging, in that what you'd want to do is to ensure that if your kids are going to spend time with others, that that they're going into an environment where nobody has recently been exposed to COVID, or nobody has a symptomatic respiratory illness. And so there should be some degree of preparation being done to bring about situational awareness on your part, as well as the part of the other family. It is very, very difficult. I think that in some situations, based on the nature of the interactions, if the kids can wear masks, they should be encouraged to do so, but not mandated, to do so. So I wish that one could give an answer that covers all scenarios. All I can say is it's important to pause, to become situationally aware of their environment, where the child is going, and to plan around it.
Thank you very much. I think that's very useful information and will help a lot of people. We've also had some questions about the preventative measures and also treatments, newer treatments for COVID. If you had any further information, and I know that you mentioned in your presentations that really that discussion should happen with an individual's physician. So I just wanted to see whether you had a further comment to that.
Yes, I think it's really important to have discussions with your physicians, because of issues around, let's take Evusheld, for example, the pre-exposure antibody that I mentioned. In an ideal world, you want to give it to everyone, but you know that there are supply issues. And so that there are some categories of individuals who are deemed to be at higher risk than others. And so you want to make sure that you know which category you're in. The second thing as well is that to become aware of what you should be doing, or your physician should be doing, if you became ill with COVID and you needed Paxlovid treatment, where would you get it, and what adjustments might be needed to the various medications that you're taking. And so a fair amount of connection with your care providers and planning, so that if something does happen, you're not making it up on the spot, and they're not making it up on the spot, so to speak.
Okay, thank you very much. Let's have a question for Corinne. We've had somebody who has been off work for two and a bit years just because of the pandemic at the moment, and they're feeling a bit of pressure to come back from work. Do you have any hints or suggestions that people could use when they're speaking to their management regarding going back to work?
Yeah, again, it's going to be very individual, because I know there are some people who have shared their whole health history with their manager or their workplace, and there are some people who are very private about that. So it really depends sort of what your history is. I understand the anxiety, though, of going back into a workplace after you've protected yourself for a couple of years and isolated. So I think part of it is sort of working yourself into that, state of being ready to do that, and then talking with your kidney team how to approach that. And if you need letters, of course, the team, the doctors, the social workers can help with that. But it might be, if you haven't shared any information with your management team, it may be time to do that, whether it's everything about your health or whether it's just the fact that you do have some immune suppression and you want to make sure you're safe, or even just talking about what you can do to isolate yourself, whether you share that information about your health or not, that you still want to be protective and make sure that you can work a little bit differently if that's possible. Because I know a lot of people are going to feel that, whether they have kidney disease or not, just anxious about going back into an environment, not sure what you're going to be bringing in or taking home. So yeah, I think preparing yourself mentally, getting some support from your kidney team if you need that, and then making a decision about how much information you share with your manager and colleagues.
It's really good information, and I'm sure many people will take that on. So thank you very much, Corinne. And Richard, I'm going to read out one of the questions that you've answered in our Q&A about from a transplant patient and how they sometimes feel silently ostracized for wearing a mask in public settings. And you've commented on this. And I think, would you like to just speak to that and share your answer with that?
Did you want me to just reiterate the answer,
If you'd just like to speak to it, that would be great.
Yeah, regarding how it feels, what other people might be thinking or feeling when you're in public with a mask. Yeah, it's something I actually thought of just today. In fact, I was out, and so there's this sense that now that fewer people are wearing masks at the grocery store or wherever you happen to be, that when other people see you, they think, "Oh, why are you still wearing a mask?" And likewise, maybe people who aren't wearing a mask are thinking, "Oh, am I being judged for not wearing a mask? Or is there a heated political debate just lurking around the corner right now?" But the reality is, you don't know what other people are thinking, and you don't really know if they're thinking anything at all. The important thing is to make the decisions that work best for you about your health and safety. Every individual has that right to decide how they're going to stay safe, if they want to continue to wear a mask, and pretty much how they want it to carry on day to day. Personally, in my opinion, the pandemic is far from over. I am a transplant patient, so I'm a special case. I need to take extra precautions. And I know this, I've been a transplant patient for a long time. And no one at the grocery store is going to know anything about me. They don't know that I've had a transplant. They don't know anything about me. And I'm not terribly concerned if they are judging me, to be perfectly frank. So the bottom line is, make those important health choices for yourself, and don't worry what other people think about them. As long as your decisions are informed and you're listening to your doctor and your medical staff, as a kidney patient, you're doing okay. So don't worry about it.
Okay, thank you very much for that.
Lydia, can I just add something at this?
I will have you, Louise, and then Dr. Allen.
L'essentiel, c'est que nous, en portant notre masque, on est convaincu que c'est la bonne chose à faire. Si on porte un masque et qu'on arrive à un endroit puis qu'on baisse la tête puis qu'on ne veut pas que quelqu'un nous juge, ben, c'est pas l'attitude idéale. Mais si on porte notre masque et qu'on est convaincu qu'on doit le porter, je pense que le message il va passer auprès des gens. Et je pense que les gens vont s'habituer de toute façon maintenant à ce qu'il y a des personnes qui continuent à porter leur masque.
Thank you very much. And Dr. Allen.
Oh, yeah, I want to say I'm very much agree with Richard 100%. I like to say that no one should feel bad about wearing a mask. And it's important to separate the removal of a mandate from an order not to do something. Removal of a mandate doesn't mean that you should, all of a sudden you're being ordered not to wear your mask. That's not what that is. And I honestly, I wear my mask everywhere I go. And one of the reasons I do that is that I do take care of vulnerable patients. And so, I have to bear that in mind. And whether it's newborns, premature babies or babies in the ICU, or cancer patients, organ transplant patients. And so I don't care what people think in that regard. I do wear my mask when appropriate, just about everywhere I go.
Very much. Dr. Silva, did you want to comment as well?
I just echo what everybody else has said so far. I think, we live in a free country. We are our own best advocates for our health. And I think, every patient should know that, and every patient should be proud of, the decisions that they make to protect themselves and to keep themselves healthy.
And unfortunately, we're almost at time. So I just really would like to thank everybody for being here today. And it's just been wonderful to have you as part of our day and part of this webinar. I know that I've learned a lot, and it's just been a pleasure to speak to you all. And thank you also to our audience for submitting some really thought-provoking and really great questions as well. So the Kidney Foundation is committed to providing information and educational resources about kidneys and kidney disease. We invite you to visit our Kidney Community Kitchen for recipes and information, and also to visit our regional branch offices virtually, where we can offer you advice and support about accessing services within the healthcare system, assisting people to access other supports in their community, and offering assistance in skills for self-advocacy. We invite you to connect with us if you have further questions by the email shown in the screen above, to speak to somebody in your community, or to access further educational materials and resources. Thank you very much.
In addition, thank you everyone again for attending this webinar, COVID-19 Navigating the New Normal. When the webinar has ended, your computer will open up to a new page requesting that you complete our webinar satisfaction survey. You will also receive a follow-up email that includes a link to the survey if you would like to complete it later. Your feedback is important to us to help us improve our webinar series, so we really do appreciate it if you will take a moment to complete it. You will also receive a follow-up email within 3 to 5 days with the link to view the on-demand recording of today's webinar. On behalf of the Kidney Foundation of Canada, thank you for joining us today. Stay well and enjoy the rest of your day. Thank you.
Thank you.